More than 10,000 babies are born every day in the United States, nearly 200 born daily in Massachusetts. Keeping mothers around for those babies is a top priority for Dr. Monica Burrell, the Commonwealth's Commissioner of Public Health.
We were one of the first states to set up a maternal mortality review committee. So a group of experts looked to see what happened during this tragic event, and really importantly, what could have been prevented or done differently in order to change the outcome. And that's important because we then take that information and share it with the clinicians who are involved, as well as the hospital and the health system.
The maternal mortality review is just one reason Massachusetts is one of the safest states to give birth. Still, Burrell sees room for improvement, especially in terms of care for women of color.
Sometimes there are medical issues, but regardless of what the medical issues are and the quality issues are, this gap is persisting. So we need to make sure that if part of the issue is an unconscious racial bias, that we address that head on.
The focus for this part of the course is on race, stereotype.
Confronting bias is the focus of a required class at the University of Massachusetts Medical School. The course focuses on conditions that may impact patient health, like their environment and access to healthy food.
I talk to them about thinking about what's happening in that individual's life. It's those factors that are so paramount in our health status: education, housing, jobs, transportation.
Professor Suzanne Cashman teaches the class along with Dr. Deborah Plummer. They give students what's called an implicit association test, which alerts them to prejudices they may have.
If that patient can see those implicit biases, that patient's much less likely to come back to me, much less likely to trust me, much less likely to follow through on my recommendations.
Students were surprised by their results.
I'm a white woman, female, heterosexual, and my results were that I have a strong automatic preference for African American people.
I had a slight automatic preference for people who are lighter skinned. What it really taught me was that, these are things that I'm carrying with me every single day, every patient room I go in.
That awareness, says Cashman, will make these students better doctors and ultimately save more lives.
It's not about guilt. We're not trying to foster guilt. We're trying to help us all raise our awareness.
Another possible solution to the maternal mortality problem: increased access to care.
We started back to doing any work stuff.
Nurse midwife Jessica Petrone is the owner of Birth Matters Midwifery Care. Today, she visits a patient at home. This kind of intimate interaction with mothers is why Petrone became a midwife.
Society has a lot of fear around birth, whether it's for safety reasons and or just the experience of it. Most women are told horror stories. It's very uncommon to just hear a positive story. Like, it was amazing, I loved meeting my baby, I felt supported.
Sleep is going great.
That's the kind of support Petrone gives women like Sarah Jenks Brightboard, who gave birth to her third child at home.
To be here with all of my stuff in my bed. I just didn't leave my room for 3 straight days. Yeah. The postpartum care is amazing. Being here on my couch in my home with women who are really looking me in the eye and asking me all of the questions and taking their time, and it's just so different. I just wanted that experience.
Though still a small percentage, a growing number of women are opting for births outside hospitals. Petrone says it's an indication of women wanting more options and more control of their birth experience.
Birth is both ancient and new each time, and that feels so special to be a part of. I like to see the care that's been given prenatally sort of all comes to this moment of labor.
We're so grateful for Western medicine when we needed it, but since everything went so well with Hazel, it felt so good to be home.
Midwives delivered just about 3% of babies back in 1989, and today it's closer to 12%, so it's grown quite a bit.
It has. Again, not a large number, but definitely an increase. A class at Harvard Business School surveyed African-American women and found many would like to work with doulas or birth advocates if or when they have or give birth.
All right. Focused on their newborns, are new mothers forgetting something?
We don't do a great job of focusing on ourselves.